most medicine we give to patients are to treat symptoms. Like you have a high blood pressure. Why do you have high blood pressure? But I'm giving you medication just to lower down your blood pressure. But I'm not helping out. I'm not treating the cause of it. See, so that's where healthy aging is going into, where they are looking out for signs to why you actually have hypertension. Is it because you're, again, everything starts from inflammation, right? And then is it in your diet? Is it in your hormones? Some people, like as they go towards menopause, they become, they have hypertension because your hormones are imbalanced and things like that. So when you talk about healthy aging and you go to doctors that are practicing healthy aging, they have a lot more tests they will do for you.
We often focus on creams and treatments to get beautiful, radiant skin. But what if the secret lies deeper within? What if premature aging is solely not due to the sun or exposure to harsh environmental factors, but a telltale sign of something more sinister happening on the inside? To talk about this, we have Dr. Liyana Dhamirah, a consultant in internal medicine and a consultant in dermatology. Dr. Liyana, whilst researching this topic, it was actually an eye-opener for me to learn that in order to be a dermatologist, you actually have to specialize in internal medicine.
That's right.
But first and foremost, what is internal medicine?
So internal medicine is, so before you start becoming a dermatologist, you have to focus on internal medicine because, as you said, the skin is also related to a lot to do with health, right? So internal medicine is general, where you specialize in everything, all the systems in your body, right? So whether it's infection, whether it's autoimmune, so generally it's everything, how your body functions. So you deal with all this kind of, whether it's acute scenario or it's a chronic illness. So that's what a consultant in internal medicine does. So when you know everything about the body, or, it's not the same as like when you subspecialize, when you only go and zoom into one organ. Like for myself, I'm a dermatologist, so I zoom into the skin. But you see there's endocrinologists where they look into hormones and things like that. And then you have hormones in diabetes and things. And when you look into cardiologists, they zoom into the heart, right? So before you can subspecialize into all these different fields, you need to know how the body functions and what actually affects the body in terms of health and diseases. So that's why it's important that, you have to specialize in internal medicine and then subspecialize into your interest fields.
And how long were you practicing internal medicine?
All in all, from the time I graduate as a medical student, up till now, up till I'm fully qualified dermatology, it took me about 15 years. So in internal medicine itself, I was practicing in the department as a medical officer, and then after that as a specialist, and then for a bit we need to we call it gazettement, where we have to fully qualified as an internal medicine consultant. So that took me about 7 to 8 years, and I loved it. I love internal medicine because I feel like I'm doing a lot of practicing the real medicine, because we treat everything. You treat dengue, we treat, when COVID was crazy, that was internal medicine as well. Of course, it involved respiratory physician, things like that, but, internal medicine was still the first line. And I treat all sorts of diseases, and I feel the satisfaction is a lot more than just regular, treating cough and cold. So that's why I wanted to specialize into something that I know that I can make a lot of difference. Yeah. So that was what I was doing for a long time until my dad was saying, because my dad is a gastroenterologist. So he's also, of course, an internal medicine specialist before. So he was saying, the age is catching up. Maybe you should start specializing, And then I was like, I was quite reluctant, but because I'm doing everything I like. But of course, the hours are long, the weekends, it takes a lot of your time, your family time, and your me time, because internal medicine is one of the most busiest field. So I said, okay, maybe it's true that I should then start subspecializing and then concentrating on something of more focus. So I decided to do something else that's a bit more relaxed, a bit more office hours, less emergency and stuff. So I chose dermatology. So dermatology training is about 3 to 4 years, and yeah. So then, all in all, it'd be about 15 years since I grad.
Right. And you've been working in the government hospitals.
Yes.
I suppose you see lots of cases in dermatology.
Yeah.
All sorts of cases.
Yeah. So I worked in internal medicine in the government in the Ministry of Health for 10 years before I switched to a university, which is a totally different set of scope of jobs, I say. Because in the university, in the Ministry of Health, is mainly a service. So we're doing a lot of ward rounds, clinics and stuff, more towards servicing, right? Servicing the public. When you switch, the reason why I switched to university is because I wanted to subspecialize, and they had a program that could, in a way, expedite my turn into getting to subspecialty, because in the Ministry of Health, there's a lot of competition among us to get into the subspecialty program. So when you join the university, then your turn will be faster, So yeah, so that's the whole reason why I switched. And I didn't know that I would actually like teaching as well. So in a university, your main job is actually lecturer and plus consultant in your field. Yeah. So while learning how to, it was like I was at that point in time in my mid-30s, and I joined the university and I started teaching undergrads, like medical school students. And that was quite a different kind of satisfaction as well. Yeah. So all in all, I was about 8 years in the university, and now I've decided that, maybe I'm in a different phase of life now. So then I just recently left the university. Yeah.
Yeah, and in Malaysia, you need to be a specialist in internal medicine before you become a dermatologist.
That's right.
Yeah, but I was informed that there is actually a move to completely bypass internal medicine.
Yes.
What are your thoughts on this? And why are they thinking about bypassing internal medicine in order to get to dermatology?
Actually, dermatology is a field that a lot of people, doctors love. It creates interest. A lot of people are interested in dermatology, but as you said, it takes a long time for you to become a dermatologist, because it takes 15 years and so. So some of them are thinking, we see cases that's related to the systemic or the body health and stuff like that in terms of skin manifestation and stuff. But we don't necessarily treat right now. I'm a dermatologist. I don't see that many cases to treating internal medicine cases. So that's why there are some people who are fighting, saying that, we're trying to bypass internal medicine because we want to probably expand our fraternity. More people, we can actually produce more dermatologists. And right now we only have like 200 something, less than 300 in the whole of Malaysia. And the demand is there, but because of the long program, subspecialty program, and then specialization stuff, it takes most people decided they can't go through that long years and that long hours that we put in, during internal medicine. So that's why my thoughts is, I still feel that I value my experience in internal medicine. And if you say that if it's a bypass program, if I had a choice to bypass the program, I would probably do half-half, because I still feel the importance of knowing internal medicine and actually treating and being skillful in that field really helps the way you think as a dermatology as well. And I think that creates invaluable experience that I think most people should go through a little bit of internal medicine and then perhaps do your dermatology. Maybe not that long years that we are required, perhaps half the time that I spend in internal medicine, maybe just a few exams. We have exams, basically. We have a lot of exams in between, and then we have to serve the compulsory years as internal medicine specialists before we could even apply into the subspecialty. So maybe that could be cut, not into the program. At least you serve a certain amount of years in internal medicine that will really help your dermatology.
Now, being an internal medicine specialist, what are the problems when that happens inside your organs, internal organs, that could manifest itself on the skin.
Yeah, so the skin is actually the window to your health. It tells you a lot of things, you know. You can see someone is like, they're 50s or 60s, but they don't look it, right? So there must be something good that's going on in their body, and probably their body is not aging to their biological age. And in terms of systemic illness, we call it, things that's going on in your body that manifests in the skin, actually pretty much everything. So you're looking at infection, perhaps, right? If you have a very bad infection, your skin flushes, skin changes into very dry skin, you get rashes sometimes, you can get even like pus everywhere your body just from infection. And that's the most common one, because the infection is still the first one that we see most commonly in the wards and stuff for internal medicine. And then we have autoimmune diseases, right? So autoimmune diseases like systemic lupus, erythematosus is actually... Autoimmune is when your cell attacks your own good cells, right? So then you have rashes on the face. There are signs that shows that you have autoimmune disease. That's the importance of you knowing how to relate clinically and what you see as a dermatology. And then there's also your cancer, right? Malignancy. Sometimes it manifests as a skin change. Okay, like you get like velvety, thickened, darkened skin if you have like perhaps a gastric cancer. So those are signs that if you don't have experience and knowing that this can happen, you probably think, and this is another rash. But actually it's a sign that, this patient might have cancer. Yeah. So a lot of things that's going on in your body can manifest as skin. Yeah. So just you looking... perhaps you look older than your age. It's also a sign, right? Is there something going on? Is there like inflammation in your body? Is there a lot of free radicals going on? Why are you aging faster than you should, right? Or is there a chronic illness, like diabetes? We consider that a chronic illness, right? So some people that don't even know they have diabetes, but they are starting to probably not look their age. Their skin starts being dry. They gain a lot of weight, things like that. So, or even not just gain weight. Sometimes they lose a lot of weight. So, like even in bad diabetes that's not well controlled, they lose weight. So yeah, so those things really is the kind of things that can manifest in skin.
Because sometimes when we get a rash, the first thing you would do is to look for some
creams
to apply on the rash. But I suppose if the rash just continues and doesn't get any better, then it's time to see an internal medicine specialist.
Because that's the importance. Like maybe you can start with the dermatology, then they probably know whether it's a rash that's just like skin level or it's really related to your something systemic in your body, right? But most of the time, the skin is your largest organ and it's the one that's in contact with the environment. So of course there'll be changes. Sometimes it gets a bit scaly, dryness, or even just like a simple fungal infection, from perhaps your pets or something when you're doing gardening outside. You can still get a small fungal infection and then you apply cream and it goes off. So it's not too worrying. But if it's something that keeps coming back and it's getting worse and things like that, then probably there's something going on with you. Yeah.
And being the largest organ of the body, I used to think that it protects everything on the inside. Not really thinking that it also absorbs a lot as well. And from the social media, I'm learning now that it actually absorbs even the toxins that may be in the clothes that you wear. I'm referring specifically to polyester. Because I do a lot of sports, and a lot of these sports outerwear or sportswear are made of polyester, and it's so difficult to find sportswear now to find sportswear that's made from like organic cotton, for example. So it worries me, how much is the skin actually absorbing all these toxins from polyester, which is actually a byproduct of petroleum and plastic and all. So it worries me. So how worried should I be? Because I am very worried all the time.
Okay, so I think your worry probably would create more free radicals than
free radicals
than the polyester. Okay, so polyester, yes, mainly the cheaper ones and the one that has higher percentage of polyester. And there are of course the different types of polyester, right? And at the moment, there's not much evidence or studies saying that it's very detrimental to health or how much it has affected humans. How much it absorbs, I wouldn't say it would be that big of a concern because yes, the microplastic is it's small, it's micro, but if you're talking about viruses are much smaller, right? But your skin protects your body from the viruses. So if you are someone that works in the textile industry, someone that works in that handles a lot of things that probably perhaps cause microplastics, then you are at higher risk, I suppose. For things to get into your bloodstream is not that easy, and the easiest way, the highest risk of getting into your bloodstream is through ingestion.
Okay.
So anything that you ingest, the stuff that you eat, the fish that is contaminated, that's from a polluted water, probably has a higher risk of you ingesting microplastic rather than your clothes. So inhalation as well. When you inhale, that's why people who work in that industry also have higher risk of inhaling microplastics in your body. And so whether or not skin has significantly may cause a risk like towards cancer or any sort of autoimmune disorders, right? These are the kind of things that you're looking at when you're talking about microplastics. So far, there's nothing big that we can say that, it's just a big study, shows that, it's very detrimental to your human health. But there are a study that showed that, when they would try and measure how much microplastic you have in the bloodstream, more than 70% people actually have them, which is not something unusual, right? Because we take things from plastic, we wear clothing, and then we eat even so-called fishes and stuff. We don't know, how bad the pollution is and things like that. So yeah, it's something very difficult to avoid. Yeah, but as long as you can choose, you choose the things that you can choose, what kind of clothes you wear, maybe something lower in the polyester level. I think a more I wouldn't say expensive. Sometimes you just look at, not necessarily everything expensive is better, right? But the cheaper ones would definitely be more worrying in terms of the percentage of polyester.
Yeah. Well, yeah. You've just raised. Virus is actually smaller, much smaller than microplastics, and our skin protects.
Yeah, exactly.
Our bodies from viruses.
Yeah.
So, okay, in the event that the body absorbs microplastics, how does it expel? Does it from the skin itself, or does it go?
No, excretion can be anywhere. So, from how your body excretes toxins, right? Through sweat. Your pores, through sweat, through urination, through pooping, right? So that's in feces and stuff. That's how you normally excrete. For example, even in things like you're trying to. I'm just giving an example because I'm a dermatologist, so I'm giving the example of a liposuction, for example, okay, or something that has a device that so-called causes your fats to dissolve. So where does this fat go? So it goes into your feces, into your urine, and then that's how it's expelled out, right? So similarly to things like toxins, like microplastic.
Yeah. When you go into the sauna,
Yes.
So they say when you sweat in the sauna, you wipe it off straight away so that new sweat can come out, and that sweat is not reabsorbed back. Does that really happen? Does the body reabsorb the sweat? It's strange. Well, when I saw that, when I read it, I was like, oh, this is something strange.
The skin is permeable. It can absorb things, and it can also excrete. But I personally don't go to the sauna and wipe it off immediately when I sweat, because I'm not too worried about it, because there are channels there in your skin that also controls this kind of thing. Once it's out, it's not easy for it to come in. So that is why, even in topical creams, not necessarily everything is absorbed. You buy very expensive creams thinking that it's going to work for you, but in actual fact, depending on your skin permeability, whether you have a lot of dead cells, whether your skin barrier is good or not, and things like that. So that also determines how much you absorb. So absorption is not as great as I mentioned, ingestion or inhalation. So it really depends on individual's skin condition. Yeah, so the sweat bit, I suppose it does make sense you can reabsorb, but I don't think it's that easy because of the channel and how it's being secreted and all the different pathways, Yeah.
You mentioned free radicals. If I worry too much, I will produce free radicals.
Yeah.
How is that? How does that work?
So when your body stresses, you have this oxidative stress. So oxidative stress are stress that you give to your cells, right? So these cells then produces free radicals. What are free radicals? Free radicals are molecules or structures that are they're not coupled, so they look for couples to make it stable. So they attack stable cells. So the more you're oxidative stressed, so you have a lot more free radicals going on that's attacking your cells. So that is where your antioxidant comes into place, right? So that then they give you the extra friend, to neutralize the free radicals so that it doesn't attack your cells and causes inflammation. Because a lot of things that in your body, every day you will have inflammation. That's something that you cannot avoid or can't prevent. It's just how much inflammation you're causing to your body. And oxidative stress, from all sorts of multifactorial issues. You were talking about physical, we're talking about emotionals, even hormones, all that can cause oxidative stress. So how much antioxidants you have is the most important thing that can neutralize all these things.
Right.
Yeah.
Antioxidants to neutralize free radicals. Right. Okay. And inflammation. So you mentioned inflammation. So how is that?
How is
to reduce inflammation?
So reduce inflammation as it's okay. So inflammation is a physiological thing. It happens to everyone every day, right? So how do we reduce it? Is of course nutrients, good lifestyle, right? So happy hormones reduces it, and new minerals, vitamins reduces it, right? So you get it from your diet. Hopefully you get it from your diet nowadays, because you never know like what you're putting yourself into. Even if it's so-called organic, is it enough? The way you cook it sometimes destroy the minerals and vitamins as well. So that is why a lot of people are going into supplementing themselves, because they feel that what they're taking is not enough to become and the antioxidants to help them fight this inflammation. Okay, because there are also things that you can do where you can measure from blood your silent inflammation, where you can know that how's your body silent inflammation doing. Because when you have a disease, that means you're already in that severe. We call it severe. Maybe your disease is not that severe, but then the inflammation is actually a lot more than what your body can handle. That's why you then have a disease. But for as long as your body can handle your inflammation, you've got good stuff that's helping you out in your body, then you don't have to worry about it causing diseases to you, right? So again, that's why people are looking into other things that's we call it healthy aging, where a lot of people are looking at supplementation, a lot of people changing their lifestyle, changing their diet, hoping that we would reduce this inflammatory process in our body, because every single disease now is related to inflammation. It starts from there, right? Be it neurodegenerative. Some people have Alzheimer's. Like physically they work so well, right? But some people just attacks the neurodegenerative part. So we're looking at those things separately now. So a lot of studies are looking at how inflammation, how bad it is, and how it affects the different types of system. Yeah.
So I think from what we've discussed so far, my conclusion is a lot more that's happening inside affects the skin rather than me worrying about environmental factors. Of course, we have to be careful. We have to use our sunblock and all that. But what goes inside, the free radicals, the inflammation, that is key.
Yeah, because that's why good skin. Yeah, correct.
Yeah. And you mentioned healthy aging.
Yeah.
As opposed to anti-aging.
So it's a new way of saying anti-aging. It used to be anti-aging, but now people are saying healthy aging. Yeah. Because you cannot anti-age, I suppose, right? You cannot anti your aging. But you want to age healthily and gracefully, the best you can, and prevent diseases. So healthy aging will will consist of things like adjusting your hormones, nutritional, and then your lifestyle. Those are healthy aging. You want to go towards aging healthily. Yeah.
So where does one go for healthy aging, like a healthy aging specialist?
Yeah, so these are like special interests. I would say that it's picking up. A lot of doctors are doing it now. a lot more, not a lot, I would say a lot more doctors are more interested in healthy aging, because we see that most medicine we give to patients are to treat symptoms. Like you have a high blood pressure. Why do you have high blood pressure? But I'm giving you medication just to lower down your blood pressure. But I'm not helping out. I'm not treating the cause of it. See, so that's where healthy aging is going into, where they are looking out for signs to why you actually have hypertension. Is it because you're, again, everything starts from inflammation, right? And then is it in your diet? Is it in your hormones? Some people, like as they go towards menopause, they become, they have hypertension because your hormones are imbalanced and things like that. So when you talk about healthy aging and you go to doctors that are practicing healthy aging, they have a lot more tests they will do for you. Okay. And when you want to look for this particular doctors, you always look for they will mention in their interests as healthy aging or anti-aging or regenerative medicine, and as their special interest. Then they will look out for, they learn, they have modules and they have programs where they teach doctors to look up for the cause instead of just treating the symptoms. So of course we still believe in conventional medicine. You know, if you have something wrong with you, we need to fix it. Yes, but those are quick fix. We want something more permanent, something that goes to the root of the cause instead of just treating symptoms. So that's what healthy aging doctors does. So it's a niche market because it's not something that's conventional, and therefore it's very expensive in terms of like sending tests. Sometimes it's not available in this country. You may need to send it outside, and then there's a lot of follow-ups, because then you will probably be started on, if your hormones are imbalanced, they will give you bioidentical hormones. So it's different from the kind of hormones that doctors normally give you, which is synthetic, right? So these are hormones that it's compounded to act similarly to your own hormones. So that's why it's called bioidentical. And so they will need a lot of follow-ups to look into it. So normally how they do it, they would try to get you back to your optimum level as you were when you were younger. Okay, because when you're talking about blood tests, for example, and you're given a range of thyroid hormones, say it's from like 10 to 100 is normal. So when you're 10, you're normal. When you're 100, you're normal. Is that it? That's too big of a average, you know? So what is optimum for you then? Then you should do, there are ways to calculate, and you know, usually they say, okay, 80% of the range is actually considered optimum. So they try to get you back to a certain amount, even though 10 is still low, but in the range is still considered normal. But I don't think 10 is normal, right? So you perhaps when you were younger, you're probably in the 60 or 70 of that range of hormones. So then you try to supplement that hormone level up to your optimum level. That's when you try and see if then everything changes when you're back to where you were when you're much younger. Yeah.
Right.
So yeah, healthy aging is a little bit more complicated than regular medicine, I would say. Because regular medicine, okay, sakit, and then you just give medicine.
Right.
Okay, your BP is okay, control with this medication. But I'm not treating the root of the cause. I don't even know why it's the root of the cause because I'm not even finding out. So those are, but I mean, we cannot afford to do that for everyone, especially when our healthcare is free, right? So yeah, but if you have the finances and the resources and accessibility, I mean, we should be looking into healthy aging. Everyone should, actually.
And you mentioned quick fixes. In terms of aesthetics, that would be the Botox and the fillers. But in terms of healthy aging, that would be regenerative medicine.
Yeah, that would be, regenerative medicine is the, I would say the extreme end, where you deal with cells, like stem cells and things like that. So stem cells are very, I want to say, what's that word? It's not fully accepted yet because of the possibility of a cell becoming something else, you know, because it's real life cells and things like that. So a lot of people are still not into licensing stem cells. I mean, the organization, there's a problem in terms of licensing and on things like that, because we don't know what it can become. But there are countries that they practice that already, regenerative medicine, quite widely, and there are case studies that shows really good results. But when you deal with things that is live, you wouldn't know the possibility that, it can mutate, it can change. So it's a lot more complicated and it's not controlled, right? Something as medicine. Medicine, you give this to this person, individual, another individual, the effect probably will be the same. Most likely 90% will be the same.
So you have a Master's of Science in Anti-Aging, Regenerative Medicine and
Aesthetics.
Medical aesthetics.
Yeah.
So you mentioned that regenerative medicine is not very popular yet because of the long-term implications.
Yeah, it's correct.
But I'm sure there are countries which have done it for 20, 30 years.
Yeah.
So how does that correlate with it being not fully researched and the long-term effects? But on the other hand, you have countries which have actually practiced it. And
correct.
I've heard of people who have taken stem cells and they look way younger.
I know.
Yeah.
So again, because I am exposed to this program, because I have Masters of Science in healthy aging, regenerative medicine, and aesthetics. So I'm exposed to it at a very much earlier, like I would say 12 years earlier. 12 years ago, see? And I'm sure in the 12 years, a lot of things have advanced a lot more. And that's why I feel that's why I'm open to seeing what is good for you and what can give you. Well, it's not the conventional way of treating a patient, but because it's not accepted fully in the fraternity, it becomes difficult to even research on it, right? And to even research on it, you need a lot of resources, and the countries that practice it. It's also political, so it's difficult for it to expand widely. And but I agree. Even myself personally, I've seen people taking stem cells, and I've heard stories. I've got patients also that have said that, I've taken this placenta stem cells. It's done wonders. It's like improve their fertility, improve their perhaps their as simple as back pain or things like that. And it's not accepted because it probably have different effects in different individuals, right? Maybe you need a different type of stem cells and I need different types of stem cells. Maybe in my body, if you give me a stem cells, because it's like a cell that it can become anything. Yeah, it can become, if you want to make it a liver cell or you make it a cardiac cell, you can. There are a lot of ways to manipulate it. So because of that manipulation, there are a lot of things that can go wrong. So it's difficult to say why. Why it's still not accepted. It's still understandable. And why it should be accepted is also something that we should be talking about more. Yeah.
So there should be more R&D in Malaysia at least?
They should. I think we're definitely starting. There are a lot of organizations that are starting on stem cells. But it's still slow. Yeah. So we probably still need to go out of the country to get what we want if we want to.
Right. Yeah. So stem cell and aesthetics. Let's talk about aesthetics. Yeah. So there's a lot of aesthetics clinic in Malaysia. I would say that it's very, very popular.
Very competitive.
Yeah.
Yes.
And the effects of fillers. I was just wondering because sometimes I can see it on people's faces. How important is it, to get the right doctor to put in the fillers? Because, I've even seen doctors with,
very filled face.
Yeah, with forehead that's not very smooth. And I, being a non-medical person, even I would say, oh, could that be a filler? That's not
irregularity.
So it worries me sometimes when I see all this, advancement in aesthetic medicine. But you actually don't know what the long-term effects are.
Yeah, but it's also personal preference. You've got some people coming in like, so filled up, very Botox, but they still want stuff done on them. So it really depends on which doctor you go to. Like if you are filled up in Botox and you come to me and you still want something on, I said, I think you have enough, because it's like my personal preference, I wouldn't want to look that way. I wouldn't want my patients to look that way. So it's important for you to have that kind of connection with your doctor and tell them what are your expectations. It's true that hyaluronic fillers now, there are a lot more research on it and saying that it actually doesn't really dissolve completely. Yeah, because especially areas that your skin is a bit thinner, like around your eyes, right? Those are more crucial places where you should be more careful when you place fillers and the kind of fillers. So that's why it's very important for you to go to the right doctors. But some people are going to beauticians, which is very scary. Of course, they charge much less, or like maybe 1/10 or much less than, I don't know how much you charge. Apparently it's very cheap, but this is your face and your health and possibility of complications, and some people really take the risk just for the low cost of doing something to your face. So HA fillers, I still believe in it. I still think that it does make a difference. When you want a quick fix, like you want a more refreshed look, you go in half an hour, you look probably 5 years younger.
Really? 5 years?
Yeah, for sure. Especially when it's under eye and you put a little bit of fillers, the right places, it gives you that little lift and a little lift on your eyebrows. Even if it's like 2 millimeters or something, it's still like your eyes look a little bit bigger. So especially it can happen in 30 minutes and you look much better. But going to the right doctors is very important, because then the right doctors will have the right skill to do it. Because if you do it wrongly, then of course you will get very irregularities. You can get irregularities, right? You can get complications even more, like the latest one with that Korean doctor, the one, got blindness, right? So so going to the right doctors is important. And as you said, there's so many aesthetic doctors now. Who do I go for? If it's a real aesthetic clinic, sometimes they claim, and this is something that's quite common, they say clinic, but it's actually a medi-spa where they don't run on license.
Medi-spa doesn't run on license.
Yeah.
Okay.
So they call it clinic and they have a doctor, but they are not licensed. So really something that public should be aware of. You need to know whether this doctor is fully licensed to practice aesthetic or not. So to open a medical aesthetic clinic, you need to be licensed. And how to be licensed is these doctors are basically, aesthetic is not like dermatology is a specialized field, right? So aesthetic is not yet, maybe soon, we don't know in the future, it's not a recognized subspecialty or a specialty. Therefore, any doctors that is already fully qualified, where they finish the housemanship or internship in 2 years, they can come out and they can learn a bit of aesthetic and they can call themselves aesthetic doctor. But what differs is when you are licensed or not. So to get licensed to become an aesthetic doctor, you need to go through some skill experience. We need to fill in a logbook and you need to be assessed. And then you will go through an interview, and then with the Ministry of Health, there's a organization that controls this. And finally, you'll be given that license, credential privileging, which is the LCP. Okay, so each doctor that practices aesthetic that opens a clinic should have an LCP, letter of credentialing and privileging. So just to make sure that everyone knows this, because it's important. Because you may see a very young doctor, and then you're not sure is she skillful enough and stuff. So then you see who actually holds the license. Maybe the doctor that holds the license is not this young doctor, but at least we know that it's safe, that they are licensed to practice aesthetic. In case of anything, you can go back to that, And these doctors that is young, usually they need to be trained by the doctors that already have that license. So you have to start somewhere, right? So and they will be trained, and after 2 or 3 years, then they will start applying for their own license. So they have to practice under a doctor that is licensed.
So it's important to do your own research, our own research, before we actually see any aesthetic doctors. Simply because you do not have to be a specialist to be an aesthetic doctor. But it is comforting to know that there is actually a body within the Ministry of Health that actually assesses all these would-be aesthetic doctors before the LCP is issued.
Correct.
Yes. Okay. Right. So, very popular in Malaysia, skin whitening. Yeah. Can we talk about that? And what is actual effect of skin whitening? I mean, I do see some people who have very, very white skin, but it's different, right? When you're naturally fair and it's due to all those things that you've injected into the skin, they become really, really white. Yeah.
I think it's getting less popular now, right? I hope so.
Well, there have been lots of content out there saying that it's actually bad.
Okay. Okay. So, healthy aging. Okay, when you're talking about antioxidants, some of the antioxidants actually suppresses your melanin production and gives you that brightening or whitening effect. But there are also drugs that can actually be given intravenously, combination that can reduce your melanin production altogether. That means you can really whiten your skin. But for a doctor, a physician, we don't want to give you unnecessary medications, be it it's a safe one or not, unless you really need them, right? So I would go towards healthy aging if you get the effect of glowing and brightening because you have good antioxidants in your body, rather than I deliver medications simply just to whiten your skin. I mean, that's what happened to Michael Jackson, right? He has super white, right? Literally super white. So that's definitely an effect of medication or some sort. He had a skin condition as well.
Well, he says it's a skin condition. From what I've read.
Yeah, he started as a skin condition, and then you just want to make sure that it looks well distributed. I mean, it's not like patches. Some areas got whitish skin, and some areas doesn't have white. So you want it all overall white. So that's what probably he also probably had some. I can't be too sure about it, but I probably think that he had. Because that is one of the disease that vitiligo, where we lose pigments in our skin, and those are autoimmune skin conditions where you have patches of white, like depigmented skin. So we're talking about really, really white, like no pigments at all, right? And you have it, like some people have it on the face, like areas where they have depigmented skin, and then like it becomes like it spreads and becomes maybe more than 50% of your body is already white patches, and some areas still have normal skin. So we want to treat that person totally, at least well distributed overall white skin. There are medications to do it. So I'm not sure, because I don't practice it, so I'm not sure what this, normally beauticians do that as well. So what they actually give a concoction of different things. Could be extra vitamins, extra medication, and things like that they give that infuse into your body, and you do have to do it a couple of sessions, and you do get that effect.
But at the end of the day, it's still by a beautician, and you do not know what the long-term effects are.
Yeah, correct. So the complications and stuff like that, we'll see probably in a few years. Like, what are the long-term complications that you get from skin whitening?
So just go for brightening.
Brightening, yes. Yeah. I would say not like super white, like what we're going for, because that will probably have a high dose of things that you probably don't need. But I mean, but vitamins, like, IV vitamins is a very common, very popular things now in Europe, even in the States. It's not so popular here yet. It's not, it's not licensed. But if it's got good effects, like in terms of antioxidants, how even they're doing it to treat cancers, to treat severe infections. There are studies and research showing that there is definitely a significant reduction on those all the severities, as I mentioned. From just IV vitamins.
IV drip.
IV drip. Yeah. Nutrition. They call it nutritional, IV nutrition.
Okay. So we've spoken about skin whitening, which is actually not really good for you if it's done through injections.
Non-licensed, and we don't know what sometimes. Beautician does it, yes.
But what about something that's good for you, that's intravenous, like vitamins and all those things which doctors actually can recommend to be done?
Yeah, so it's getting more popular nowadays, this IV nutrition, and more in Europe countries where they even have IV nutrition clinic. In nearest to us would be Bangkok, where they have it's a big market. Is IV nutrition. To me, in a body, you really require a lot of vitamins, minerals to function very well. And all this you try to get from your diet, which is really impossible for you to eat like a whole bowl of antioxidant every single day to, help fight your free radicals. So I believe in supplementation. So for myself, I do take supplements because I know I'm not able to sustain that kind of diet that my body needs. So when you talk about IV, theoretically it would be better because it surpasses your digestive tract. You don't need to take pills because it goes straight to your bloodstream. So especially in patients that perhaps have autoimmune diseases that are lacking of these vitamins and minerals, simply because maybe they can't even go under the sun to get a vitamin D, perhaps, as an example. And vitamin C, it's purely from your diet, and you can't get it because you have poor digestive tract, doesn't absorb. Where are you going to get this vitamin C? So I think IV nutritional has a value, right? Because then it goes straight to your bloodstream. It doesn't need your body to absorb, and it doesn't need your gut to absorb and then process. And you would benefit immediate from this intravenous solution. Yeah.
So it benefits the body in terms of nutrition and also the skin.
Correct.
What is this NAD which I've been hearing? Does it come in the form of IV as well?
It's getting more popular. It's definitely something that you see in my FYP, in my feeds, right?
Yeah.
Always talking about NADs because I'm always researching things like anti-aging, healthy aging and things like that. So NAD is getting more popular and more accepted around by people who know what it does. So as you grow older, your cells create energy, be it for anything, right? Just to simply for your physiological daily things that it processes. So these ATPs, I think everybody knows ATP. I hope so. It's just it's like a chemical that your cell produces to create energy, and energy is needed for every cell to function.
Okay.
So as you grow older, say you're in the 40s, this energy, cellular energy, is down to 50%. So maybe when you're 20, it's 100%. Now you're at ATP 50%. So that explains why you get really tired very fast. You age externally, but I'm sure you age internally as well because you're lacking of energy to function. So NAD feeds that pathway, but it helps to create more energy, creates more ATP. So that's why it's more accepted, because people can see the effects of it by taking it intravenously. In some countries, they have intravenous. They have subcutaneous, where you inject, locally injections every week, and by injection supplements, and liposomal they call it. So that you have to make sure you buy the right supplements to get the right effect. So like when you ingest, it's important that it doesn't get destroyed by your acid in your stomach and things like that. So you have to make sure that the right kind of delivery method, let's say they call it liposomal, it's protected, so it's not being destroyed by your digestive tract. So
to make it easy, you just inject it in intravenously, right? So you don't have to worry.
Sadly, it's not available or licensed in our country. And not yet. I hope soon. I don't know when, but we are looking at a lot of research and studies showing that there is some benefits. As I mentioned, I'm more towards treating the cause. What is the cause that we're getting this lack of energy? Are we going to just say, oh, it's okay, it's part of aging? Are we going to accept not being able to sleep at night with all insomnias and like being so tired by evening time? When you can function much better, and you want to prolong a life, it's fine, but you want a quality life. You don't want to be living and not being able to do the things that you want. So this NAD is definitely something that we can look into.
But for now, we have to go to Bangkok. It's the nearest place to get it done.
I suppose the most important thing is always engage to the right doctor that knows the right resources, that knows what is safe. Okay. So don't go do it and like not at least there's a lot of doctors, as I mentioned, we know that's practicing healthy aging a lot more than last time. So we go to these doctors, I'm sure they have their ways to help you out with it if you're really interested in an AD. Yeah.
Right.
As a supplement, I think it's quite readily available online.
Online?
Yeah.
I have my doubts about ordering online.
So you have to go to the right company, with a reputable company, reputable supplement supplement app. Now I use the app sometimes.
All right.
Yeah, and I've got like the supplements I buy are from the same places that I know in the States, for example, in America, where they have an organization that actually checks on different brands of supplements, and they would then rate it whether what they claim is right or not. Let's say they say X percentage of vitamin C or X percentage of melatonin. Is it true that they have that amount? Is it safe? So they have a regulatory body that monitors these things. So then from there, then you say, okay, this brand seems to be a good potential one. You can trust it, then I buy from them.
So you buy directly from the website?
Yeah, your website will be good. Yeah,
Right,
there's also an app that actually sells
yeah.
all this different types of supplements.
Right, because there's this huge marketplace which sells everything under the sun, and there's been publicity about supplements that people get from this marketplace.
Yeah.
There's lots of like not original
ones. Yeah.
That's worrying when you read about it.
Yeah.
Yeah, but so go to the
reputable websites and stuff. Yeah, goes direct to them. Again, doctors that practice this kind of things would know.
Oh, right. Okay.
Yeah, and they can compound it for you as well. Like it's more like personalized if you really require. Yeah,
right.
That's safer, I suppose. A safe option.
Okay, NAD, the next thing for me to check my list.
Yes, definitely.
Thank you so much, Dr. Liyana.
Thank you for inviting me.
Yeah, definitely. Definitely, I feel a bit more less worried. So less free radicals in my body now with this issue on clothing materials and how much the skin actually absorbs, which is actually within a tolerable level now, I realize. Previously, I was very worried, and after speaking to you, and definitely improve what we take, as in food and vitamins and supplements, intravenously and NAD.
Yeah.
Thank you for that.
Okay, welcome.